Have you ever experienced the moment of pleasure, the buildup of intimacy, the contractions of orgasm, but then suddenly realized nothing came out? No semen, no release, just confusion. If this has ever happened to you, you're not alone. And the truth is, while it can feel alarming, it's usually not dangerous. In fact, it often has a clear explanation, and more importantly, clear steps you can take to understand it, manage it, and regain confidence. Welcome to the Healthy Body. Dr. Alex here. Today we're diving into a topic that many men, especially those over 60, find deeply confusing and even frightening: dry orgasms, also known as retrograde ejaculation. We'll break down why this happens, the most common causes, and the safe, effective action steps you can take to handle it with clarity and confidence. We'll also discuss medical options, lifestyle adjustments, and how to talk to your doctor in a way that gets real answers. And before we begin, if you enjoy clear, science-based explanations on healthy aging, vitality, circulation, and natural ways to protect your health, don't forget to hit that subscribe button. That way you won't miss any of our upcoming videos designed to keep both men and women thriving at every stage of life. So let's start by demystifying what's really happening when a man climaxes, but nothing comes out. Imagine this scenario. You reach orgasm, your body feels the familiar contractions, but no semen is released. For many men, the first reaction is panic. Am I broken? Is this the end of my sexual function? The good news is, no, you're not broken, and this does not mean the end of your sexual pleasure. What's happening is most likely something called retrograde ejaculation. Here's an easy way to picture it. Inside your body, the urethra is like a shared roadway. It carries both urine and semen out of the body, but never at the same time. At the base of the bladder is a small, powerful muscle called the bladder neck muscle. Think of it like a traffic gate at a fork in the road. When you urinate, this gate opens and lets urine pass out through the urethra. During orgasm, that gate should slam shut, forcing semen to exit only one way, forward, through the penis. But in retrograde ejaculation, that gate doesn't close properly. Instead of being pushed out, semen takes the easier path backward into the bladder. Later, when you urinate, it simply flushes out mixed with urine. Here's the first and most important reassurance. This is not harmful. The semen dissolves in the urine and exits naturally. It's not a sign of cancer. It's not a sign your masculinity is gone. It's a mechanical issue with a clear cause. But while it isn't dangerous, it can be a signal of something else happening in your health that deserves attention. Have you ever noticed changes in your sexual function after a surgery, new medication, or health condition? Drop a comment below. Your story might help another man who's silently going through the same thing. So why does this happen more often in men over 60? Let's talk about the usual suspects. The first common cause is prostate surgery. If you've ever had surgery for an enlarged prostate, particularly a procedure called a TURP, or transurethral resection of the prostate, this is one of the most frequent causes. These surgeries are often lifesavers, helping men urinate more freely. But as a side effect, they can sometimes weaken or alter the bladder neck muscle. It's not your fault, and it doesn't mean the surgery failed. It's simply a trade-off that comes with certain treatments. The second common cause is medication. This one surprises many men. Medications that are prescribed for common age-related conditions can relax the very muscles we need to stay firm during orgasm. Take alpha blockers, for example, drugs like tamsulosin. These are excellent for improving urine flow in men with enlarged prostates. But the very same muscle relaxation that helps your bladder empty can also prevent the bladder neck from sealing tightly during orgasm. And it's not just prostate drugs. Some blood pressure medications, and even antidepressants can have similar side effects. The third common cause is nerve-related conditions. Sometimes the problem isn't the muscle, but the signal telling the muscle what to do. Long-term, uncontrolled diabetes is a major culprit here, because it can damage the nerves that coordinate sexual function. Other neurological conditions can play a role as well. So here's your first detective exercise. Think back. Did this problem start after surgery? After starting a new prescription? After years of diabetes or another chronic condition? That timeline is often the biggest clue. So far, we've learned that dry orgasms, or retrograde ejaculation, aren't harmful, but they are usually caused by either prostate surgery, certain medications, or nerve-related conditions. And the first step toward control is identifying which factor fits your situation. Before we continue, if you're finding this helpful, make sure you're subscribed to The Healthy Body. We've got new videos coming on natural supplements, circulation boosters, and hormone balancing strategies that can help men and women age with energy and vitality. Don't miss out. Now let's move into what you should do. Here's your 3-step action plan. Step 1. Don't panic. Gather information. The very first step is to pause and become an investigator of your own health. Ask, when did this begin? Try to pinpoint not just the year, but the exact month if you can. What changed around that time? A new medication? A surgery? A diagnosis? This timeline is gold. It helps you and your doctor connect the dots. Step 2. Become a medicine cabinet detective. Write down every single medication you're taking, prescriptions, over-the-counter, even supplements. If you're on an alpha blocker like tamsulosin, highlight it. This doesn't mean you should stop taking it. Never do that without medical supervision, but it gives you and your doctor a clear picture of possible contributors. Step 3. Schedule a doctor's appointment. This is the power move. Armed with your notes, go to your doctor and say, "Doctor, I think I'm experiencing retrograde ejaculation. It started about this long ago. Here are the medications I'm currently taking. I'd like to know if there's a connection and what my options are." That single conversation can transform you from a worried patient into an informed partner in your own care. So what might your doctor suggest? Let's walk through the medical options. If medication is the cause, sometimes the simplest fix is switching you to a different drug that doesn't carry this side effect. Other times, adjusting the dosage or timing of when you take the pill can make a difference. If fertility is important to you, for example, if you still want children, your doctor might prescribe medications such as pseudoephedrine, which tighten the bladder neck muscle. But here's the caution. These drugs can raise blood pressure, so they aren't safe for everyone, especially those with heart conditions. In cases where retrograde ejaculation is permanent, such as after certain prostate surgeries, the focus shifts to acceptance. And here's the key point. The pleasure of orgasm is not lost. The sensations, contractions, and climax remain intact. The only difference is where the semen goes. Many men, once they understand this, feel relief, and their intimacy continues without fear. Would knowing the condition is harmless bring you peace of mind? Or would you still want medical treatment? Let me know in the comments. We've now covered what retrograde ejaculation is, the main causes after 60, your 3-step action plan, and what medical solutions might be available. Remember, this condition is usually harmless, but understanding the why and talking openly with your doctor are the keys to confidence. So let's tie this all together. Dry orgasms can feel shocking the first time they happen. But now you know, they're not a mystery. They're usually a side effect of surgery, medication, or nerve changes. They don't mean you're broken. They don't mean the end of your pleasure. The path forward is clear. Recognize what's happening. Investigate the possible causes in your own life. And communicate openly with your doctor about your options. By taking these steps, you move from confusion and fear to clarity and control. And remember, you are not alone. Thousands of men experience this, but very few talk about it. By commenting, sharing, and supporting one another, we can break the silence and help others feel less isolated. If this video gave you clarity, I invite you to subscribe to The Healthy Body. Every week we share science-backed strategies for boosting energy, improving circulation, balancing hormones, and staying vibrant at any age. And if you'd like a natural next step, I recommend watching our upcoming video on 3 essential vitamins that help restore energy and sexual vitality after 60. It's the perfect companion to what we've discussed today. I'm Dr. Alex, and I want to thank you for taking the time to invest in your health and well-being today. Until next time, stay informed, stay healthy, and stay confident.